Hi, everybody. This is Jane in Helena, and Deb Halliday is here with me. She's going to be our presenter. And it looks like we have kind of a, not a robust crowd today, but I know that the weather has kept some folks home, and I did get a couple emails about people who weren't feeling that well. So we're going to go ahead and get started. And Deb is an expert in collective impact. And I think there's a real demand for this content with everyone focusing on the chief health strategist practices and the need to really work across sectors and better connect ourselves with the primary care community as well. So Deb has a long history of working with this model, and she worked with OPI and used this model on graduation rates and had measurable outcomes using it. So I really consider her to be an expert in this area, and I'm really pleased that she could be here today. She braved the snow, came across town. She's here in my fancy office, and we're really glad to provide this today. So I'm going to let her take it from here. And I know that she is going to also have some interaction, more interaction probably than we've had in the past on these calls. So I think it'll be pretty fun and an interesting experiment to boot. So,
all right. Cool.
Okay, thanks, Deb.
Thanks, Jane. So thanks for making time on this snowy day for this good conversation. I am going to play a little bit with the interactive components of Zoom. And so if you have video, it'd be awesome. Richland County looking good. So if you have video, that's great. And then also there'll be times that we're going to put you into breakout rooms that even if you're on the phone, you're going to want to unmute because you'll be in a breakout room with a couple other people and trying to have a discussion. And so part of that is just I'm kind of interested in how we can have more rich, collaborative, interactive experiences, virtually. And I also think that in a state like Montana that's so big and it's so expensive, time-wise and transportation-wise to get together, that if we can have these kind of rich interactions in between times face-to-face, we'll just maybe get more work done and continue to do the relationship building that we do. So in our time together today, I'm just gonna, I hope that you can see this slide deck that we've put together. We're gonna talk a little bit about collective impact and how it looks in Montana, explore a couple different ways to think about our collaboration work that we do. I think that what the common interest that people have in collective impact is that so many of us are regularly trying to do big things, knowing that we need to bring together different sectors to accomplish that work. And what collective impact has really allowed is some common language for practitioners, as well as some frameworks to organize our work, to start thinking a little bit more intentionally about like, where is it really working, where is it not working, and why, and what can we do about it? So just for kicks and giggles, if you're comfortable getting onto the chat box, I'm going to ask a question. How familiar are you with collective impact? And you could say, 1 equals what's collective impact? And 5 equals I could be doing this training. So I'm typing that as a question, and just to kind of get you into the chat boxy part of Zoom, which is one of the ways to stay communicating with one another. If anyone wants to type in, there's Christy's a 3, whoop whoop. The LCPH folks are 4, that's awesome. Looks like Richard's taking a poll and they're gonna enter in a 2, cool. So awesome, that just gives me a little bit of a sense of where folks are at. And it is, I think it's, collective impact has gotten very much part of the discussions that we often bump into in our work, both here and in the region and nationally. So I like to bring in an intention when I do these kinds of trainings, which is one of my favorite quotes from Margaret Wheatley, that people own that which they help to build. Margaret Wheatley, if you don't know her work, is very fascinating. She started off as a scientist and then observed sort of big mega trends in science like chaos theory and quantum physics, and started to apply that to organizational development, so how humans interact, and has become in her time on our planet to be someone who works around the world with communities, helping them really understand how to do their work and do it together. And what I appreciate about this particular quote is that the work we do is very complex, and it requires a lot of different perspectives to have a rich understanding of what the challenges are, as well as what the opportunities for impactful work are. And that really the power of the process of inviting people in and authentically engaging with them about that, and helping them really co-create and build something with you, builds in that sense of understanding and patience and compassion and ownership that we need to do both systems work, but also the work of individuals trying to continue to move through the world in a more impactful way. So just bringing that intention into this work. So this is going to be the first time we're going to try to do a breakout room and see what this does for us. And hopefully we won't lose people. And if we do, you can pop back in. So I'm going to ask you, I'm going to put you into a breakout rooms, which what that looks like is you'll basically you'll be popped off of this screen, and you'll be brought into a room of your own. And it's going to be groups of two, one team, one group, one room will have 3. And I'll ask you just to engage with each other around this question. So you want to unmute, and you'll be in your group. And then I'll give you about 2 minutes to do this, and I'll put a little banner on the top of your breakout room that says you have 60 seconds more. So the question is, how long have you been a community builder? What led you to be a community builder? What do you love about it? So I'll give you a few minutes in the breakout rooms just to kick that question around. I'm also going to type it into the chat box because you might lose access. I'm not sure if you're going to still be able to see the slideshow in this. So I'm going to kick you into them now, and we'll let you know in about 2 or 3 minutes when it's time to kick back out.
There we are.
Hi, everybody. How is that?
How'd that go?
Oh, it went good.
Awesome. All right, well, we're gonna keep going. We were joined by Claire. Hi, Claire. And then Andy, I think we had a hard time getting you into a breakout room, but we'll keep trying. Okay, so I'm gonna talk a little bit about collective impact and just kind of give you some of the foundations. And then we'll do a couple more of those where we'll stick you into smaller groups. So thanks for your patience as we figure these out. So this is some work that Liz Weaver, who's one of my mentors, she's out of Tamarack Institute, and a colleague of hers put together that I think is a very helpful way to think about our community change work that we do. And they are positing that every effective community change effort has 3 components to it. There's a framework, which provides for both a kind of a roadmap and common language to help a team navigate change, to kind of land it. I think public health has some, as you know, some really awesome frameworks that kind of lays the land, and then you can kind of assess where you are in there and what you would want to do. So collective impact is a framework, and then I think public health is probably more of a leading player in the social welfare industry around the different frameworks that like another one would be the universal triangles of public health, of universalism, intervention, and the tippy top. So there's a framework that everybody agrees that we will work through this framework and use this framework in our community change work. The second is principles, and principles are really the overt, spoken, written down, agreed upon ways that we strive to work together. And so a principle could be, we'll do targeted universalism, where we want everything we do to benefit everybody, but with a particular perspective of the people who most need those services. Or another principle could be nothing about us without us, which is a popular term coming out of the disabilities community that basically says that as we're creating program, as we're creating our understanding of what we're trying to do here, we won't do that work, we won't do that sense making, that problem solving, that problem identification without some legitimate representation of the people who have the lived experience that we're trying to support or whatever. So groups have a framework, they spend some time developing some principles around how do they really strive to do this work together. And then they have practices, which are just, that's a lot of what I end up doing with groups, is helping them figure out how do we make decisions? How do we come to consensus? Maybe consensus isn't the best place to do this. How do we do a really great jobs doing our environmental scan and understanding and sense making about where our priorities should be? The actual things that just we do, which are, our worksheets and our facilitation and our ways that we do this work together. So one of the things I really appreciate about Collective Impact is that there's a culture in Collective Impact to crowdsource all the tools. And so I'll show you a slide in a little bit of some of the big thinkers, the organizations that generate a lot of tools and a lot of trainings, and almost all their work is crowdsourced. So you can go online and you can find, how do I build a good team? How do I identify who those team members are? How do I really work with data in a way that brings in people who are not comfortable with data? So all those practices get informed into this work.
She's down there at the bottom as the source.
See, should I mute people? We mute everybody. This is Jane being powerful, but I don't know how to.
Yeah.
Mute everybody. Manage participants. Mute all. Okay, I'm muting everybody.
But
all right. So then I'm going to give you just a couple examples of what I mean by collective impact, which I'll bring into the discussion as we move along here. So Jane had mentioned that I had some good fortune to work with then State Superintendent Denise Juneau at the Office of Public Instruction, and built for her an initiative called Graduation Matters Montana, which ended up being very active in over 50 communities in Montana, and still have some communities that are really wed to working the Graduation Matters framework. It was basically sort of a simpler version of collective impact, in that you had a team and you looked at data and practices and communicated. Graduation Matters has had great success, and our high school graduation rate continues to rise, which to me is very satisfying, because it feels like that's what we mean by sustainability, is that things continue to go well, even though we're not pumping a lot of our intentionality into it from a centralized place like the state education agency. And collective impact, or rather Graduation Matters Montana, is seen as a really good model of a rural collective impact initiative. So I'll kind of talk about that a little bit. The second one is there's an organization that's one of the early examples of effective collective impact group work out of Cincinnati, Ohio, called Strive. And Strive really popularized and helped to operationalize this concept of a cradle to career pathway. And so what that really is encouraging the community to kind of look at the different systems and neighborhoods and organizations and families, and see if they could imagine a seamless transition from when a child is born to when they come into kindergarten, graduate from high school, and go on to the next steps in life. And to what extent can the institutions and programs and services that are built around supporting those successes, how can they align their work so that a community, a family just moves through those without having to navigate a lot of different systems and a lot of different struggles. So both of those, the Graduation Matters Montana and the Cradle to Career, have really benefited from using a framework like collective impact to help different institutions and services that work maybe with the same family but different members of the family based on how it all shakes out, help them gather some language, put some data in it, talk about it, and move it. So to do this work today, I want to this is not my language around a balcony and a dance floor, but I'm going to invite us all onto the balcony in our work, which is that on a day-to-day basis, we're often on the dance floor. We're reacting to things, we're doing our emails, we're shucking and jiving and getting it all done. But we're, we have that sense of like getting stuck here or moving over there, but we're not sure why we're stuck over here and it's moving over there. So when you get up off the dance floor and onto the balcony, you start to see how things lay out in your community. It's like the big organizations that are doing different pieces, the money that might be coming in from the feds or the state that's going to influence this particular set of programs and services, the families, how are they just kind of having some sense about how do families physically and move in your community. They get up and they go over there and then they go over there, and where do they go over there, and how do you sort of just embrace your understanding of your community from that perspective. And what I really like about this, there's a couple of things. One is that that Montana in general, we have fairly simple economies in our communities, even our larger cities relative to other places. They're fairly simple economies. So you can without a whole lot of effort, you can name the players, you can name some of the big trends. So that's one thing, just kind of get our heads around. And the second thing is that when you bring people together, we all sort of know at some basic level that there's value in having multiple perspectives. There's value in having multiple industries in your work. But what do you do once they're all together, and what really is the value beyond just sort of a moral value? And one of the values is that they each have a different perspective. They stand on a different part of the balcony than you do, right? And so if you have exercises, you have practices that allow you to pool the intelligence of all those people who have different understandings, and you together come up with a shared, complex, but accurate and helpful understanding of your community, you can find things that are going on that are really awesome that you wish you'd like to build on. You can find places where the gaps are and people are trying different things. A great example of this from my own work was when I was working with Graduation Matters Montana. I was working in a community of about maybe 15,000 people, and we had the school district, and we had law enforcement, and we had some nonprofit organizations and some students and some families, and everyone's talking. And so the topic was around high school graduation, high school dropout. And at one point, someone from the law enforcement said to the leader of the school, the principal of the school, they said, do you know that when someone from your school, when a kid drops out, we send a wraparound team to their house to see if we can help them figure out how to deal with whatever's going on and get back into school? And the principal said, no, I didn't know that. And then the person from the law enforcement said, and do you know that we've been trying to get the school to tell us when a kid stops showing up after several times so we can go do that before 2 or 3 weeks have passed? And the principal said, no, I didn't know that. And so and what would happen is that Mary at the school, who's girlfriends with Joni at law enforcement, would call, would say, hey Joni, we haven't seen Bobby for the last few weeks. And Joni says, okay, we're on it. And so that's like an example of the power of relationships, right? In our communities, that we know each other, we can get a lot done informally. But when Joni leaves her job, who's Mary going to call? Like, so there's not a lot of institutional alignment going on. It's this kind of relational. And it's also an example of the school district's going to start this big initiative, Graduation Matters, in their community, and they don't know that another really big institution in their community, law enforcement, has actually already got some wonderful things going on to support kids' success. And so that happens all over the place all the time, because we're all really we're in it for the right reasons, and the work is hard and challenging, so we often jump into our own rabbit holes and do as much work as we can, and we have fewer opportunities to come out and talk to each other about what we're doing and seeing where the linkages are. So collective impact is very intentional about, that's why you bring those different groups of people together, not just to come together, but actually to do some systems mapping with one another, to pile on and do some pilots around some interesting things, to do work together that's about trying to support the system that you're trying to change. This goes to 1:30, right? 1.
It can go.
Okay. All right. So, so here's our challenge. And I love the simplicity of this language that we're program rich and system poor. And so we have in any community, or you can think about our state, we have these different programs, we have institutions, we have initiatives and grants, and say that that horizontal line there that has a little bit of an arrow at the end. Say that you're trying to improve. You're trying to do more work around diabetes prevention, and there's different programs and different things happening in the community. So there are actually services and programs and hospitals and schools, but their ability to have some interconnective tissue in between those different initiatives, those different programs, those different services is weak. And that's just where we are. I think of that almost as in an evolutionary aspect, that's just where we are as humans and as communities. And I like to think that my granddaughters will be like, "Whoa," and I'll be able to know what's going on, and they'll be able to coordinating. But we're not there yet. And so our hubris, our intent here is to do more alignment between those different services and programs to increase community capacity to anticipate and address the challenges that we have. And that collective impact is a framework that helps us do that, because oftentimes what that line ends up being is 3 to 4 to 5 shared measures that we all say that of all the data we swim in, all the data we have to collect and report to our different grants and all that jazz, that we can come up with 3 to 5 common data points that we either already collect or it's not going to be too difficult to collect, that if we can track those and move those, we will actually move the dial on this issue. Okay. So I think I'm doing a whole lot of talking. If you have questions, just do the chat box or insist on being unmuted. So I'm going to talk a little bit about where collective impact is particularly well suited. And so this is this wonderful work from Brenda Zimmerman about complexity. And so there's 3 different kinds of problems or types of problems that she's laying out here. The first is a simple problem, and her example is making soup, where the challenge and the solutions are relatively known. So the idea here is that, if you do these steps, you will pretty much be able to produce that particular soup. And I like to joke that this is holds true for everybody, but my daughter, when she makes cookies, it's really, you just never know what's going to come out of the oven. But maybe she's not following the recipe. So pretty simple. The next one is complicated. And complicated, the example that Zimmerman brings up is sending a rocket to the moon, where there's a lot of complexity, there's a lot of specialized movements and knowledge, but pretty much if you get the right people with the right information and you're putting it into the predictable places and you sequence it the right way, you can do this complicated thing. And then the third example is complex. And I don't know how many of you have more than one child in your life. Either they're yours or they're your friends, or they're through your family. No 2 children are the same, right? And not only are they not the same, like you can't just bring out the Dr. Spock book and read chapter 14 and your kid's going to be awesome at whatever the behavior was or the growth. But they're not only are no 2 kids the same, they're constantly growing up, right? So their needs are changing, their capacities are changing, their curiosities are changing. So it's really unknowable, right? And so that's the world that we live in, right? For whatever crazy reason we have chosen to be in this social sector, where really the solutions aren't totally knowable, right? We have hunches, we have opportunities. There's an alignment at sometimes when the right people are at the heads of different organizations and some money comes along and you can do some things. But then one person leaves and then another person comes in and they have this whole other idea they want to do because they came from some big urban area and they think they're going to do some schooling, And so everything's constantly changing about that. So this is where collective impact has has found purchase in this work. So complex problems are difficult to frame. When we were doing our Graduation Matters Montana work and kids are dropping out of school, are they dropping out of school because they don't feel safe at the school, so it's school culture? Are they dropping out of school because they've got a lot of problems at home and the chaos is too much for them? Are they not dropping out of school because they've got an awesome family, but they need more people working, and so that student feels like the very best thing they can do is support their family right now? Are they dropping out of school because they have they're super bored and the school doesn't have the resources to really provide that kid the challenges that they need? It's difficult to frame it, right? You can't just blame that family or that school or that kid. It could be any of those, and it could be any combination of those at any particular time. They're diverse stakeholders. So I'm doing a lot of work right now in early childhood, and trying to figure out the ways to connect with employers about the impact of having unaffordable preschool and childcare available in our communities, because it impact not just on their workers or employees who are worried about where their kids are and if they're safe, but the long-term impacts of kids not having awesome places to be when they're very, very little, right? So there's lots of stakeholders that come into that conversation if you think about it in the ways that they should be thought of, because it's complex and it kicks into all parts of our community. As I mentioned earlier, dynamics, they evolve. There's no one single measure of success, right? There's the cause and effect of the relationships are unclear. You might think that, because you did these things and some good things came out of it, it might be a nice little tidy bow. Now we'll just do these things in this community, but it didn't have the same outcome. So what is that about? This is your work. I don't want to re-traumatize you. Like, I know it's complex, but what part of what is helpful about collective impact is it both lands in this space, but it also helps to normalize it. So I think that it's easy when things are complex to want to shut down the complexity and just do something. And then what happens sometimes, as you know, is that there's unintended consequences about what you did, and you shut something down that's over here that actually was really great. So collective impact just allows you and helps you to normalize with your colleagues. Yet, yes, this is complex, and really it's about our best understanding at this time about what we will do, and being open to continuing to learn, evolve, and adjust. So there's a lot of humility that comes into this work, understanding that even if I've been doing this for 25 years, I still have a tremendous amount of humility about what is really going to work in this particular point in time with this particular set of needs that we have in our community. So there's really no not wonky definition of collective impact. This is probably the unwonkiest, and it's by one of the groups that has a lot of quarter in collective impact right now, called FSG, which is a national organization, and it doesn't actually stand for anything. But they're the people who did the preliminary research and developed the framework of collective impact about 7 years ago. And so collective impact is the commitment of a group of key actors from different sectors to develop a common agenda for solving a specific social problem. So I'll unpack that a little bit. So it's a commitment of key actors, and that language is around if we got all the right people in the room and they were empowered to do the thing that they most wanted to be able to do, we think we could move this hard and fast and in the right direction. So sometimes it's like, yeah, sometimes it's the CEOs, the heads of organizations. A lot of times it's the people who have the credibility, some access to power, and it's from different sectors. So it's not just like, in the early childcare space, there's a lot of pressure it's just the early childhood people, and they'll take care of that. And then the kids will come to my school and then I'll start taking care of them. It's like recognizing that, to leverage as many of the resources as you can, you need the key actors from different sectors. Developing a common agenda, we'll talk about that a little bit in a bit. It's really easy to glaze over this and be like, oh yeah, we're all in this together because we love you know, we all want walkable communities, so we're all together. But a common agenda is actually a pretty specific thing that when, even though you do 18 things in your day-to-day life, when you come into this room with this particular group of people, you are all working on this particular thing, and you've negotiated it, and you protect it from new things happening and changes of things, that this is the thing that you guys are working on together. So collective impact is not, I think you've heard me say this a little bit, and I think you guys are really comfortable with these concepts, but you know, it's not a single sector approach. It doesn't focus on individual programs and single sector, single focus solutions. It's not looking at short-term impacts. It's really trying to create a vessel where those organizations and people and institutions can come back again and again and again with data informing their work to move something forward. So if this is interesting to you, if it isn't, I will not be offended. If you're like, I'm gonna go make some hot cocoa and I don't know what Hallie's talking about. But if this is interesting to you, I mentioned earlier that there's a lot of generosity about the tools that people use for collective impact. And so these are some of the organizations that are easy to Google and just kind of get in on. Tamarack is I'm a stringer for them. They're out of Canada. And so I do a lot of training for them in the lower 48. And their work is mainly around poverty reduction. They've done some really remarkable work in Canada around poverty reduction, and they're working increasingly around the world with their tools. The Collective Impact Forum, that's that FSG group and Aspen Institute. That one you could go on Collective Impact Forum, and just by giving them, I think, just your name and your email, I don't think you have to be they're not too curious about you. You have access to all their toolkits and, you know, all that. Strive Together is that Cradle to Career group I talked about out of Cincinnati. And Living Cities is sort of the big dogs. This is the New York City and LA and Dallas. It's big cities that are doing a lot of work trying to do workforce development with Black and Latino young men mainly. So I'm going to do two chunks of what this is and give you some time to play around with them. The first one is there's a concept that there are 3 preconditions to doing collective impact. So collective impact is not just your typical coalition that gets together and, you know, shares information and supports one another, but just kind of pretty much stays in your lane. Collective impact is really asking people to step out of their own total self-interest hat and create something together. And so having influential champions, people who can say, yes, this matters, yes, this work has possibility, we should all be excited about it. Having an urgency of issue, you know, this does require more time and effort out of groups. So choosing an issue that really feels like it's something that's merits that of attention in your community, and adequate resources. And really in Montana, that tends to be the people resources, because we all wear so many hats, right? And so having enough staff to be able to be attentive to this and really help it move forward, I think is probably our biggest challenge. So I'm going to go through these, and I'm going to ask you to do in the chat box. So get ready to type something in the chat box. I'm going to ask you a question in a couple of slides. So the first one of why influential champions matter. They can raise the profile of the issue. They have the ability to impact a system by either redirecting funding, assigning program staff, reworking policies and priorities. They increase the credibility when you're trying to involve multiple organizations. They can provide passion for you and justification. This is my old boss. She wouldn't like me to call her old, but Denise Juneau, who really, it's not like communities hadn't thought of graduation rates. It's just that they didn't have this sort of leader person who could, you know, make them feel like it was really important and that it was something that we could all do together. And then Dolly Parton has this wonderful imagination library initiative around young people and literacy. And so an example from my work more recently is in early childhood, I got the school superintendent to get involved with a local collective impact initiative. And I wasn't asking him to come to lots of meetings and thrash around with us. My main ask was, can I have your wicked smart data person on my data work group? And he said, you bet. And so then I had access to school data, not like me personally, but I had access to somebody who really knew data, who could communicate data, and then as we were moving along in the initiative, we wanted to do a quick turnaround survey of a bunch of parents with incoming kindergartners, and people in the community were like, oh, you're never going to get that survey through the school. The school is sort of famous for being difficult to get decisions made, much less quick decisions. And because I already had the superintendent on my steering committee, who again had not really gone to any meetings, but had met with me a couple of times and knew what we were trying to do, he said, you bet, and it happened, right? So just, and when those things happen, the other people in the initiative are like, wow, we really can do something here because we've seen something just happen. It's a miracle. So different kinds of influence. It doesn't just have to be, and a lot of times it's actually not the heads of organizations because they're so busy, and honestly, so many of them really don't even know what's going on in their organization because they hang out most of the time with other people and the heads of things. Not all the time, but sometimes. But there's also informal leaders, particularly in our smaller communities. You know, there's the wonderful term of Mabel at the table. If Mabel's at the table, then things get done. And if Mabel's not at the table, you're probably not going to get much done. So who are those Mabels, and are those Mabels people that you could talk to and get them to be part of your work? There are moral spheres of influence: youth, indigenous leaders, faith, elders, people who can say, kind of rise out of the programmatic political frame and be like, this is about what we're about as a community, as a people, and we need to do this work together. And then this is sort of a grandiose term of mine, the epicenters of change. You know, the groups that are United Ways, foundations, some of our city county health departments are seen as like, that's where we go to get stuff done, right? And if that group that has a track record of getting hard things done is part of this host work, it's gonna pop it. So on your own, if you wouldn't mind, just if anything comes to mind, I'll just give us a little short moment here, but in the group chat, the question is, what kinds of influencers do you already have engaged, and who might you want to invite in? So if you're comfortable just sharing, we have these kinds of folks, and we'd love to have these kind of folks, and just see if that's something that inspires you to share in the chat box. Yeah, this lacking of an epicenter of change, that is one of our challenges, as you guys know, is we have such fragile organizational infrastructure in our communities.
I would suggest be the epicenter.
Oh, Jane is saying, be the epicenter of change. We could have another workshop on that. Okay. Yes, Jane is saying that the community, we are all right. We think the health department's epicenter of change.
Yes.
Amen. All right, fun. Thank you. So then this next one is around strategies to create urgency. And so, so again, urgency is really that sense that this is something that merits our attention, merits our efforts. And so ways to create that urgency, one is to help people voice their frustration with the existing limited work that's happening, right? And so you'll often see that in, people will organize people to come speak at a city council meeting or a school board. You can use data to create a compelling story. I think that, we're really, for me, data used to be a 4-letter word, but, more and more data seems to be, we have more and more access to data than we ever have. And so, using it not just to say you should care because here's the need, but weaving that into a narrative around what is the story of our community, where has it been in this issue, how is this different right now, and what gives us hope that we could actually move this based on the capacities that we have in our community at this point. Elevating voices of people with lived experience, releasing reports, using a compelling funding opportunity. I think that a lot of these are communication strategies, and I think that one of the things that we are flat-footed about in general in social welfare work is that we're so busy doing the work we forget to tell our stories, right? And we forget to talk to the press when something really awesome happens, or go to the Chamber of Commerce and ask to have some time on their agenda to do that work. So there's a lot of ways to do that. So what I'm going to do is I'm going to ask you to, I wonder if I can cut and paste this. I bet I can. Copy. I'm going to ask you, we're going to put you back into breakout rooms, and I'm going to ask you to just talk to each other. Oh, yeah, it did work. Talk to each other a little bit about how have you been able to respond to or create a sense of urgency in your work, and what continues to be challenging. So I'm going to give you about 4 minutes. I'm putting you in groups. Again. Is that okay that we've got, Bill? Do we want to move
a few less? 3 would be about perfect.
Yeah, what's two in each? Oh, it's bigger. Sorry guys, a sec. You want me to do?
Maybe do 3.
3. Okay, that good?
Yeah.
Cool. All right, so I'm going to open the rooms and just invite you to engage around that. How have you been able to create a sense of urgency or respond to one, and what continues to be challenging? All right, well, I'm going to mute y'all again. That's your punishment. If you want to put anything in the chat box, that's cool too. All right, so we will keep moving here, and I think we're going to try to go till 1:15, and so hopefully folks can hang out, because I get to get to the juicy part now, which is, well, just finish up here. I think I mentioned, connection is unstable. That the third precondition is around adequate resources, and so really recognizing that this work takes time and effort, and that is often our challenge, right? Is having enough capacity to do this work and can do it well. Let's pause. Okay, all right. I will stop messing around with that. Okay, so if you're at the coffee shop and someone says, "Hey, man, I heard you went on a webinar around collective impact. What are those 5 conditions?" This is the meat and potatoes of collective impact. These are, when I said earlier that one of the real values of collective impact is that you bring some simplicity to complexity, right? So you bring some shared language to the complex work of collaboration, multi-sector collaboration. So there are these 5 components or conditions. One is the common agenda, which we've talked about a little bit. Another is shared measurement, mutually reinforcing activities, continuous communication, and backbone support. And so I'm going to describe those to you briefly, and then I think you guys have a handout that Jane sent to you that if you have that, we're going to spend a little time and have you crosswalk those conditions with an initiative that you're a part of now. So common agenda, I mentioned that earlier. It's really that shared vision. It's takes some work to do well and to really nail it and make sure everyone understands that even though they have a whole bunch of stuff going on, this particular gathering of people focuses on this particular thing. This is where that nothing about us without us can be very powerful, because it's one thing to say we're going to work on early childhood. It's another thing to say we're going to work on this particular piece of early childhood because we've done this work and we've talked to families and we've really come to understand that we think this is going to be the highest level impact that we can get on something. The second is around shared measurement. And I mentioned earlier, and unfortunately it's true, that I've thought of data as a 4-letter word in my past. I thought, if you just give me some money and give me some time and maybe a cell phone, I'll get some stuff done for you. But really, in our, as you know, our industries are really evolving to where there's a lot of data out there now. And, some of it is not actionable, and that doesn't help us. But a lot of it is, and we just sort of sit on it, and we don't take the time to really do some, what I call sense making around it. Like, what does this mean for us? What does this mean for our programming, for our outreach? And so the shared measurement is not just about my program looking at data. It's about, with all the different groups around the table, really having a vibrant conversation about, if we could boil it down to 3 or 5 or 7 measures that we think that if we could move these, we would see change happen. That's the work. And that might seem sort of daunting, and it can be challenging. We just last year I worked with Healthy Mothers, Healthy Babies, and I think some of you were in and out of that process through your Best Beginnings councils, where we came up with 10 measures of well-being of early childhood. And it was a consensus process of taking data that already exists. And now this was a Best Beginnings Council request of local coalitions. Like, now that we have these 10 measures, how might we start doing some cross-fertilization between communities to land on a couple of those and really start seeing if we could move them, right? Mutually reinforcing activities is kind of upping the ante about what we talk about when we say that we're collaborating with one another. So it's less about sign my letter of support, come to my event, hand out flyers. It's more about what can we do to stack our programming, stack our services to really try to move something. So it's sort of high leverage coordination of activities. Continuous communication is this really kind of raising the bar and calling out that this work requires a lot of communication, a lot of, not just meetings and emails, but going and talking to people and kind of doing what I call shuttle diplomacy, where you try to figure out who really needs to be talking to who to start tying the connections together. And then all that work is basically, just sort of that next level of intensity above and beyond what we do in a lot of our coalitions. And so one of the real benefits of collective impact has been, it's called out the relevance of the term that they use is backbone support. And so just like in our bodies, we have a backbone that holds everything up, it's invisible and it's sort of in the background. The backbone support is that group of people or that individual or that organization who says, we will staff this, we will make sure people convene, we will, help to track down the resources we need. So say we know that we need some help around data. The backbone doesn't say, okay, we're going to go figure out how to do data. The backbone might say, well, who do we know in our community who knows how to do data? Can we pull them in for a few meetings to help us with this? And basically just assures that it moves forward, that the intention around the common agenda and the data stays central to the discussion. So example, in collect around how the 5 conditions play off of Graduation Matters Montana, we had our frame was team data practices celebrate. And so we had a team that came together to create their common agenda of what they're going to do around high school graduation. The state really helped them come up with some measurements around how they were going to identify success. Mutually reinforcing activities. Our language was practices, like what are we going to do? So we want to do a mentoring program. How do we figure out the community organizations or individuals or the churches that are trying to do mentoring and bring that up to scale in the school? And then that we called it Celebrate, which was sort of that continuous communication. And then the state, the Office of Public Instruction, and my staff, we were the backbone. We were the ones convening. We were making sure people had the tools they needed. We were putting out toolkits. We were running around the state doing trainings. We were helping it move forward. So I'm going to give you a few minutes on your own. If you don't have that sheet that Jane sent you, it's not a big deal. You can just look at this. It's a little hard to read if your computer screen is small. But what I want you to do is I want you to think of a project you have, an initiative you're working on, and go through each of the 5 conditions. So that first one, common agenda, all the members of the team know and agree to why we meet. And so if everyone kind of comes together and, it's just a big pile on about sharing information and the agenda switches around each time and it's just a forum for sharing information, you might say that there's not a lot of agreement about why we come together, or if it's a group that's really focused around diabetes prevention and each time you're together you've got a pretty tight agenda and you're looking at it, you might say, yeah, we're really clear about what we're doing. So just put a little X kind of where you are on that continuum, or if you don't have a printout kind of on a piece of paper with each of those. I'll give you a few minutes on your own, and then I'm going to pop you into breakout rooms to just share what you what you've been doing. Okay, I'm gonna, just for the last little bit we have here, I'm gonna just run you through the rest of sort of how this work looks. And then we'll call it good. So I'm gonna skip this next exercise just because we've got some time, but first I'm gonna give you, I was telling Jane, this is my creepy picture of Stephen Covey. So I don't know if you've read 7 Habits of Highly Effective People at some point in your life, but it continues to be very satisfying for me. But he's sort of widely regarded as using this term, progress moves at the speed of trust. And so I think that what I really, and I will often kind of explore this with folks, but the whole idea that that this work is hard and it's relational and it's complex. And so unless you have that trust with people, people will vote, you know, with their feet or opt out of being a part of it. But if you do spend the time doing the relational development with people, as you know from your own experience, all sorts of magical things happen where you can, you know, share resources and share information and share connections and make the work really sing. And so always, you know, at every meeting I do, even if I've been working with the same people for a long time, I try to do something that just sort of reinforces the development of trust and relationship. So the last couple slides are really about collective impact and how it's moving in its continuum. So on the far left, you see that you know, specialized agendas, fragmented measurements, independent activities, sporadic communication, unsupported efforts. That's really where a lot of our business as usual lies, right? Where we're individual organizations trying to do the very best we can with our work, maybe trying to reach out to other folks, but you know, at a fairly sporadic way. And then really trying to move into that middle column. That's a lot of what we've been talking about today, is what happens when different organizations or entities can come up to a common agenda. What happens if they could agree on some shared measurements that they'll track together and hold each other accountable? What happens when we start really piling on around our activities, our communication? What happens when we actually have some infrastructure, staffing support to do this work? But that's not where it stops. It really, the aspiration of this work is moving from, you know, not just a common agenda around this group, but a common community aspiration for how do we want our community, how do we want to be with one another, how do we want to grow and age and pass in our communities. From shared measurement to shared learning. How do we have that humility, recognizing that things change and are always kind of in flux, to hew that line, that through line of learning and tying that to our measurement. From mutually reinforcing activities, of really thinking about what are those leverages around our systems change focus. From continuous communication to authentic community engagement. How do we have these discussions and really have that be robust? And finally, that from the backbone infrastructure to that container for community change. How do we create or reinforce and support our capacity as a community when different things come in and out of our community, whether they're opportunities or whether they're crises? How do we continue to build the interstitial tissue within our community to be able to rise to those challenges and opportunities? And so that's where this work really sits, and it pulls together practitioners really at this point from all around the world who are practicing these conditions, who are coming up with ways to do this community work together. I'm not going to belabor this. This is something that I'm glad to share these slides, but it kind of helps you look at the different components of your work and kind of put it into different phases, which I think you're kind of familiar with these kinds of formats, but this one is particularly, you know, part of the collective impact world. And then just kind of wrapping up, you know, what we're learning in a lot of collective impact initiatives happen in larger communities where they, like I joke that they have data teams and we're like, oh, we have 2 hours every other week with a data person, you know, so that's just our reality, right? And that's probably partly why we love to live in our communities, is that there are these manageable, livable sizes. But so in rural communities, we're finding that absolutely the value of having common language for complex collaboration, to be able to say, wait, I'm not clear about what our common agenda is here, or you know, what are we talking about when we talk about our shared measurements? Or, hey, wait a minute, I just picked up the paper and I read about a new initiative that you're a part of. What happened to that commitment to continuous communication, man, you know? So it really just allows you to bring some simplicity to that complexity. It puts good pressure on data to be the center of our work. As I, have said, really gone are the days when we can just say, we don't know the data. We don't, it's, there's a lot we can be doing with that. And it's not just quantitative, but qualitative. There's lots of really legit ways to get the pulse of the experience of families having, or communities having, organizations are having, and then measure that and hold yourself accountable to it. We have to be creative about the infrastructure that's required around backbone functions, and we have limited infrastructure in our rural communities. I've done a lot of coaching in communities where I'll ask for 10 hours a month of 2 or 3 really smart entrepreneurial people who are already doing things in other organizations, but they come together and I coach them through being that backbone support for an initiative, and that works pretty well until you start getting enough momentum where you can start bringing some money in to hire some staff. And that, as you know, in our rural areas, people wear lots of hats and related to one another. There's a lot of existing history and relationships and communities, and just being really savvy about trying to leverage that for your work. So I'll leave you with 2 just kind of fun things. One is the collective impact, or our lives, right? We think we got this plan and we're going to get to the end. And the reality is that it's just, there's lots of unknowns and unexpecteds in our path, but it's having that common agenda, having that vision, the data to support and ballast you, the influential champions to work with you, where you just are working through it on a regular basis. And then I like to end with one of my favorite quotes, that never doubt that a small group of thoughtful, committed people can change the world. Indeed, it's the only thing that ever has. And that's what you guys do every day. And I know you're very busy people, so I appreciate Jane inviting me to take up a little bit of your time to talk about something that I love, and hopefully it's helpful for you.
Thanks so much, Deb. I really appreciate it.
Yep.
Okay, thanks everybody. We'll talk soon. Bye-bye.